thank you to all of y'all for giving me this award for starting the Congestive Heart Failure Clinic. We started a program not knowing how it was going to work, and it's taken off better than we ever expected it to. We started by patients that were seen in the hospital. Their biggest complaint and their biggest problem for readmissions under 30 days were because of not understanding their discharge instructions when they left the hospital. So we opened a clinic that I met them for the first time when they were admitted, and then they came and saw us outpatient to better understand their discharge instructions and keep them out of the hospital. So we monitored blood work, looked at their weight, gave them more discharge instructions, followed up with them so they understood what they needed to do to keep themselves out of the hospital. This has tremendously reduced costs associated for the hospitals and the physicians. Readmission rates are down tremendously, about 95%. One minute, are you serious? That's only 1 minute.
Keep going.
Readmission rates are down by 95%. Their lab values are much better. BNP levels are down. Patients are eating what they're supposed to eat, following a diet, coming in every week like they're supposed to. Some of them are even, they come in once or every month or 2 months just because they want to continue to come in and see somebody, to have somebody look at their weights and help them track their daily weights and make sure that they're following the plan that they need to follow. The physicians are happy because the patients are not readmitted within 30 days. Thanks, Mom. I appreciate that.
I was just telling you how long. Can we ask questions?
Yeah, ask me a question.
Is this real or fake? Is there really a place like this?
No, there's not, but I really would like to open a clinic like this.
Okay, go ahead.
That's what we talked about.
Okay, well I didn't know what this was.
There really is a clinic. Okay, sit still. The physicians are much happier because their patients are not readmitted within 30 days. Insurance companies are pleased because a lot of them have stopped covering 30-day readmissions for congestive heart failure. The hospitals are glad because they're able to see more patients and treat more patients, and their beds aren't taken up with heart failure education. The patients are thrown so much at one time when they're admitted to the hospital that they don't understand. When they go home, they're confused. When they look at all their paperwork and their discharge instructions, they don't know what diet to follow, they don't know what medicines to take, nor do they know how often they need to weigh themselves. By coming in as an outpatient, we teach them more and at a slower pace about weighing themselves daily and eating the proper meals and following up with their physicians, and how important it is to weigh themselves daily. That is the biggest ticket. So we've succeeded, and we're going to keep going and see where it takes us. Thank you.
How much do y'all monitor their weight?
Every day.
I know, but if they gain how much weight?
If they gain more than 2 pounds in a day or 5 pounds in a week, then they need to increase their weight.
My daddy's cardiologist said 3 pounds.
Well, your daddy's cardiologist needs to go back and re-educate himself.
Well, you need to